to discuss the administration's final rule on the Title X Family Planning Program issued late February that would make it more difficult to access essential services like birth control, HIV and STD testing, women's and men's health care, and pregnancy testing for individuals in underserved areas. This rule would directly hurt 4 Title X funded health centers in my district and thousands of my constituents who are served by them, often in underserved areas. Let me explain. The final rule prohibits Title X providers like those in my district from referring their patients for abortion services despite being allowed under current law, and even if the patient specifically requests it. Never mind that Title X already cannot fund any abortion. But that means doctors won't be able to provide the best medical advice to their patients. It also requires all Title X grantees to have strict financial and physical separation from any activities that fall outside the program scopes. That means a facility where 97% of the services are for prevention, cancer screenings, oral contraceptives, STD screenings, would not be able to receive Title X funds. They would have to, in order to receive these funds, build an entire different facility, which is costly, cost prohibitive, and they won't be able to do that. What most likely will happen if this is allowed to go forward is these clinics will shut down, making breast exams, pap smears, and other critical healthcare services available for those who need it. So I want to get your sense, Secretary Azar. Do you believe that the Title X program has successfully served as a source of critical preventative care for patients?
The Title X program is very important. It provides important resources, contraceptive and comprehensive family planning for individuals, and that's why we fully funded it. But we also want to ensure the fiscal integrity of the program.
So let me ask you, then why has the administration chosen to move forward with changes to the program that would drastically alter how the current program operates and how patients can receive care?
By definition, in the example you just gave, federal taxpayer money is being used to support the provision of abortions. It's subsidizing that. If they wouldn't be able to run that business independently absent our Title X money,
but those monies cannot go towards abortion. Those monies help for breast exams, pap smears, and other preventative services. That's what they use those monies for. It is illegal for them to use that money for abortions. Can you explain why you believe that withholding necessary information from patients from doctors, even when specifically requested, even if a patient specifically requests, what are your referrals, where can I go if I'm considering an abortion, et cetera, is appropriate under medical ethics?
So under the final rule, we allow, as the statute allows, non-directive counseling, including related to abortion, and the provider is allowed to provide a list of service providers, including those that do provide abortions, but they're not allowed to just pick up the phone and actually directly refer them over.
Okay. Do you believe this rule will increase access to care for patients served by Title X?
I think we actually may see an influx of additional providers willing to come in and be part of Title X, and these are fiscal integrity provisions.
So in terms of access, in terms of a young woman's ability to get their pap smears going to an underserved area where the only providers are those receiving Title X funds, 98% of their services are for oral contraception, family planning, counseling, and breast exams, as well as pap smears, et cetera, for cancer prevention. You think by defunding them or making it hard for them to function in their clinic when they're the only clinic in that community is going to increase healthcare access for women?
Not allowing them to, through the Title X program, affiliate support abortions.
I would take that as
shouldn't be a problem. Shouldn't in fact impact their operations.
Well, it will. That's the whole point of this conversation, is that it will. It creates barriers for those individuals who provide 98% of their services, basic primary care, to deliver on those services.
Gentleman's time has expired. Important conversation.